Take care of you. Okay, you want to begin the new year looking great and feeling great. So as you head to the gym and get your body looking good, don't forget about your face. It's always nice to have Dr. Gary Gesualdi from Affordable Botox here on the show. Good to see you.
Good to see you, Julie.
So the name of the business is Affordable Botox, but we're not talking Botox today.
No, not today. We got something much more exciting.
All right, it's in this little box.
In this little box, Voluma, big things in small boxes.
Yeah. Okay,
it's
this
all
is
about
called,
pumping up the volume.
I'm going to hold it. This is called Voluma.
That's correct.
And it's made by the same people who make Botox.
Allergan's the company, and they make Botox and Juvederm, and now the new game changer, Voluma.
And you were the first MD here in Chattanooga.
That's correct.
To begin to use this.
That's right.
So what makes the contents of this little box have such a big punch?
Well, it's a huge difference from the other fillers we've used in the past. In the past, we were able to put gels that would sort of fill in. Okay.
That's what the
Juvederm, right? Because
okay.
Botox is for muscles that we're moving. We try to, soften those muscles. We never really had something for the mid face and upper face. People go in the mirror oftentimes. A lot of my patients will come and say, "I want that look." We really weren't able to do that, and surgery was the only option. But now with Voluma, it has a spring-like consistency. It's a very soft, smooth gel, and when you inject it here, it instantly, you can see it actually lift up the cheeks and augment some of the areas that we see soften up or maybe fall down a little bit from the aging process.
One of the things that's so remarkable, it sounds like, about this too, is that once you've done the injections, it lasts for 2 years.
FDA approved to last up to 2 years.
That's fantastic.
That's huge.
So do most people need just one injection on either side of their face, or depending on your condition, might you need more?
Depends on the condition, yeah. It could be one syringe, could be two, could be more for some people.
Okay.
The investment, it can be quite a bit up front if they need more than 2 syringes. Most don't, but some do. But again, with a 2-year longevity, it does make it more cost effective that way.
Okay, if you're looking at this, and you were telling me too that, and we have some before and after pictures where you can kind of see what Gary's talking about, because it is immediate. So there you're seeing how her cheeks kind of just sag down a little.
Right, and the big thing you can see in this picture, I think shows it best, is that when you do inject the upper cheek area, okay, along the sides of the eye, that whole area, and down right where the redness is on her cheek where we put ice, you'll see how it softens all the other areas below that besides the part that got injected.
Okay, so that's the before picture, and there it is.
Yeah.
And that's instantaneous.
Instant. That's crazy.
Does it feel funny? Do people tell you that it feels
Well, they're too
tingly or
excited when I
anything?
look in the mirror to see the difference, that they're just more elated and filled with joy than they are about how funny it feels.
Where we're seeing that her cheek is red, is that where you did the injection?
Exactly.
That's pretty remarkable, Gary.
And so besides lifting and filling, we're adding volume. It's lifting up from the volume because this gel has this spring-like consistency that under the skin it actually will expand and pull up the skin that has sagged. But it's also taken and smoothing out the lower areas as well because the skin is being sort of stretched a little bit.
She looked years younger.
Well, if you think of a prune losing volume over time,
It
right?
becomes a
and we
grape
go
again.
right. If we go ahead and inject that prune, the filling out effect is besides locally where it's injected, it also has an effect on the whole face, like there as well.
Now, the redness that we see, how long does that tend to last?
Oh, it's gone before they get in the car and go home.
Okay.
A lot of that's from the ice. It's not the irritation, it's the ice we apply before we inject it.
I had asked you about side effects. You mentioned kind of the typical things, primarily bruising.
Absolutely. I think in the right hands with a board-certified surgeon or facial cosmetic specialist, you're going to be okay. The bruising, I haven't had any yet, but it's going to occur. It can. But I think you want to stick with someone who's very, very familiar with the deep tissue anatomy, because the skill level is a little more advanced than you would see with Botox or typical filler injections. So I think there's enough good doctors in Chattanooga that have the requirements. I don't think the average Botox doc or nurse who may be good at those other things really should be doing this deep tissue injection because of the potential for damage to nerves and blood vessels.
Okay, and since you were saying that really what's happening here is that you're giving back the volume that we just naturally lose over time.
And that's the key word, Julie, is it naturally. We're not cutting skin, we're not rearranging anything. We're giving how you looked 5, 10 years ago is what we're trying to restore.
Okay, so on me, for example, It's beginning to sag a little bit here on me.
I don't see the sagging so much, and I think most people agree that you have beautiful facial features.
Oh, I like you, Gary.
I know you do. But without smiling, you'll see that this is fine. But if we did Voluma on you, we want to go in this area here and get that roundness back. See, that's lost. So the light shines differently?
Yeah.
That's the big thing, is if you get the roundness, if you lose that, the light doesn't bounce off. Once you create that roundness, you get this light bouncing off that makes such a youthful, huge difference. It's pretty much what I could tell people young from across the room. The light just bounces off the face because everything on their face is rounded.
Okay, so if you're someone, I'm in my mid-40s.
Okay.
So if I did something like this, is it better to do it as a preventive than to wait until, say, you're in your mid-50s when you might need more vials?
I think the preventive aspect for most facial cosmetic injectables that I do is probably more of a good business move and marketing, perhaps. I think you want to see immediate effects because you have had the age-related losses, and you want to correct that.
Okay.
I do think it could be too soon for some people to come in with the mindset that this won't happen.
Okay.
It has to happen a little bit. You can wait till your late 30s, early 40s, but you wouldn't do it preventive. I wouldn't. I would discourage that.
Okay.
I'd wait to have some volume loss that I know that we can inject and see a difference, and that will last 2 years.
Well, it's a timely topic. I mentioned to you earlier the Today Show was talking about teenagers experiencing problems with bullying and turning to some cosmetic procedures.
It's terrible.
Far too young at that age. But there's a lot that you can do. It helps a person's self-esteem.
I think we're going to see a lot more injectable procedures being done by even surgeons who do the plastic surgery because that's so invasive. So the fat transfer, the cheek implants, they'll replace this with the Voluma. They'll be using this as well. Okay.
That's the product, Voluma. The business, affordable Botox. Gary was the first one in town to begin using it. Only been on the market now for about a month, you said?
Over just a little bit over a month.
Okay, so this is brand new. His office is right there on Gun Barrel Road. There's his phone number and his website. And again, you said just make sure that whoever you use, make sure they're board certified.
Exactly.
Thank you so much.
Thank you.
Happy New Year to you.
Thank you, too.
We're back with more. I'm going to do like this right after this.